An advanced care directive is a document that helps guide your physician and your family in how to take care of you if you're unable to let them know what kind of care you want. For instance, if you are in a coma or if you have an illness that you're unlikely to recover from, how would you want to be treated? What kind of care would you want to receive? Often when we're admitted to the hospital staff ask us these questions, and it's good before that time to kind of have an idea of where you stand. For instance, some people, if they were in a coma or if they had an illness that they weren't likely to recover from, may want to be put on a breathing machine and kept alive with a breathing machine, or to have a feeding tube administer nutrition to them for a long period of time. Other people may feel strongly that they don't want those sort of artificial means to be used to keep them alive. So it's important to have this discussion with your family members, with your physician, before something like this happens, especially people who are older or people who have diseases like end-stage or severe lung disease, severe heart disease, or cancers. Very important to have these discussions and to make these things clear to your family and to your friends and physicians. Now, a living will is a document that just maps out for the people in your life what kind of care you would want if you have a terminal condition. So, how you would like to be treated, whether or not you'd want some of the life-sustaining or life-prolonging measures performed. But it doesn't really map out who's going to help make those medical decisions. It's just a guideline for the type of decisions you'd like made. Another important component of your care is a durable power of attorney. So many of us at some point in our lives will reach a point where we're not able to make decisions for ourselves, but we have somebody that we trust, somebody who we know would make the decisions that were compatible with our wishes. And so we need to let everyone know who those people are. And so a durable power of attorney is an advanced directive that points out who that person would be. And in states like Texas, you can have this designated and have two people who aren't related to you sign that this is the person that you designate as your durable power of attorney, and that can be a binding legal document. And then, of course, you want to have the discussions with this durable power of attorney person about the kind of care you would want in different situations. Now, a do not resuscitate order is something that is very important when a person is admitted to the hospital. So if a patient has a terminal condition, if they have, say end-stage cancer or heart disease, and their heart stops beating, then the hospital staff is they will automatically go into a pattern where they'll do CPR, they'll shock the patient, they'll put a tube down and start to breathe, and a machine and start to breathe for the patient. So if someone says, well, I don't think I really want that because of where I am in my illness, then that has to be made clear to the hospital staff, because they unless that do not resuscitate order is on the chart, they're going to go ahead and implement the full resuscitation and CPR. So a do not resuscitate order helps to guide the hospital staff into knowing that if someone stops breathing and their heart stops, to let them go and let them pass peacefully. Now, the do not resuscitate order does not mean that the person would be denied antibiotics or pain-relieving medicines or oxygen or things to keep them comfortable. Not at all. Do not resuscitate just really applies to when the heart stops and when the person stops breathing. The question arises, well, do I really need a living will? Do I really need these different directives, advanced directives? Well, people who have terminal cancer, who are in the process of dying, it's tremendously important for them to have this mapped out, because it gives them really a sense of control over the end of their life. They can decide what they want done and who they want to participate in their care. But unfortunately, in the world we live in, serious accidents and illnesses can arise very, very quickly. So family doctors encourage anyone who's over 18 to think about these sorts of things and to fill out these durable power of attorneys, these advanced directives, and to discuss them with their family doctor and with their loved ones. The paperwork for these are easy to obtain from websites. I know in my office I have the paperwork available for anyone in the room. So very much encourage everyone to think about advanced directives and to make the step to really to protect your loved ones from having to struggle with deciding what's the kind of care that you would want. If you haven't talked with them about it, if you haven't given them guidance, then they'll be guessing, and then that can cause them guilt and anguish, and that's really not necessary. So make your advanced directives, do your durable power of attorneys. You'll have the peace of mind, and your family members may really thank you for it in the future.